Hello, I am Nurse Faladi, and I'm here to just share with you some tips that helped me in nursing school. And another thing you should keep in mind is that every patient has the right to their health. They have the right to their health in one sense. In what sense? Why should you approach a patient you want to perform a procedure and then you are not even explaining this procedure to the patient, nor are you taking consent from the patient? You just go there in the name of you are the nurse and then you just want to start doing your things. Who does that? This patient has a right to their health. So if you keep it in mind, it's just you being human and treating others with respect. You want to perform a procedure for a patient. If you actually respect this patient, then you should deem it fit to explain whatever you are doing for this patient. You want to pass a catheter for a patient, and then you just get there, you just open the patient up and say, I want to put a catheter. Just like that. No. But if you respect this patient, then it would actually come to your mind that, okay, you have to explain this procedure to this patient. Let the patient see the reasons why they have to do these things. Okay, Mr. Jones, I'm here to pass a catheter for you. Why? What is catheter? This is the first time Mr. Jones is hearing about a catheter. So what is catheter and why did he need a catheter? He has not been using this. So why did you want to introduce a catheter? Okay, I want to this is this. You start by explaining what you want to do. Mr. Jones, I'm here to pass a catheter for you. Then why are you passing this catheter? Okay, I want to monitor your fluid intake and output. Okay, you are bedridden and you don't have the energy, you don't have the strength to go to the toilet, so I'll just pass this catheter and keep helping you in draining the urine. So even with the explanation you are giving to this patient, then there is this confidence, there is this peace, there is this willingness. They would actually consent to it when you give them the reasons to do it. But when you don't give them the reason to do it, then they just want to scared. They just want you to go. They don't want you because you are not respecting them. So another very important thing that the examiners are looking at is your relationship with the patient. Communication. It is very, very important. As a nurse, your relationship with your patient matters. Yes, you are the nurse. You are always by the side of this patient. You are the first contact with this patient even before the patient sees a doctor. So what kind of relationship do you have with your patients? What kind of relationship do you have with your patient? So during that period of time you are approaching this patient for any procedure, the examiner wants to see what kind of relationship you have built with this patient and the one you are even building at that point. You're approaching the patient, okay, you've taken consent, yes, this patient has agreed to whatever procedure you are doing, but then how human are you in performing this procedure? You're passing a catheter, yes, as I'm using that as an example, you're passing a catheter for a patient. Don't you think it will be painful? Yes, you are doing it the right way. Very true. And this patient has already consented to it. But don't you think this catheterization would be painful to this patient? This patient has not been on catheter. So you are catheterizing this patient for the first time, and this is just you introducing another external object into this patient. So don't you think it will be painful then? How are you relating with the patient in the process of passing the catheter? Because the patient has already consented and then you clean and then you start passing the catheter. You are not even concerned about the expression of the patient, verbal expression, or even putting in words like just saying sorry, I hope you are not feeling pain, please bear with the pain, it's going to relieve you, it's just within a period of time, saying words that are comforting to this patient, this blah blah blah. But then you are just there passing this catheter. You are not even concerned with if this patient is in pain or not. Definitely you are repeating the exam. So the examiner is looking out for how much you care, how much empathy you would show for this patient while performing any of this procedure. But when you are seeing a mannequin before you likely not care if the mannequin is in pain or not. But if you are seeing a patient before you, then you put yourself in the shoe of this patient, and you know that this patient is likely having pain, and then you just want to comfort the patient. This is going to save you from failure. Then lastly, I would say after you've performed any procedure on your patient, I think a feedback is very, very important. You have just catheterized a patient. Why not a feedback like any problem size, is there any discomfort you are feeling at the moment and you want to address that? There should always be a room for feedback after any procedure. Maybe you are just served a medication, a feedback like opened your mouth or like engaging the patient in a talk to actually know that okay, this patient has swallowed the medication, has swallowed whatever drug or this thing, like okay, you've performed a procedure. A feedback is very, very important for the patient. How are you feeling, man? To know if you had successfully done whatever you are doing for the patient. So a feedback is very important, and a simple thank you. A simple thank you can go a long way. That's you showing courtesy. Thank you, Mr. John. You were so cooperative. Yes. Thank you. You were so cooperative in the course of me doing the procedure. I admire your cooperation. I admire your tolerance. Yes, you could say sweet words to make this patient feel they had done well. Yes, I admire your tolerance. So many people would not even be as calm as you were. So you're telling this patient you are just trying to be courtesy, like this is giving an impression to your examiner that you have a good relationship with this patient, and then the patient even feels you are concerned about them. It's not just, you are not just focused on whatever procedure, just your job. You are not just focused on whatever procedure you are doing for them, but you're also concerned about their feelings about this procedure, and you are very sure that they are aware of how this procedure is going to happen. I hope this has helped someone. Just stick to do these things. Be calm. Don't be tense. Don't be tense. See anything, any patient you are seeing. Yes, it could be a live patient and it could be a mannequin. Just see this patient as someone you have built a relationship with, someone you have built a relationship with, rather, someone you have been with for a long time, someone you are putting your best for. Then that way you would be relieved of tension. Don't be tense, because if you are tensed, don't look at the examiner. The examiner is not wanting you to look at them, but your patient. Just be lost in the world of relationship with your patient. Be lost with your patient, not with the examiner. But then you have to be time conscious as well. You have to be time conscious. You have 15 minutes for this procedure, so you are not just engrossed in discussion with your patient while you are living out the procedure. Even as you are being fast with your procedure, then you're just seeing this patient as someone you have a good relationship with, someone you are building a relationship with, and you want to smile, you want to engage this patient. That way you are saving yourself from failure. I hope this helped you. If this helped you, let me know in the comment section, and if you need any clarity, you can as well let me know in the comment section. I wish you success and good luck.